Lillian McDermott, weekdays at noon on AM 1510, FM 99.9, 94.7, and 100.7. The views expressed on the following program are those of the hosts, callers, and guests, and are not necessarily those of WMEL staff, management, or advertisers.
This is Joe Steckler, folks, your host for Helping Seniors, a radio arm of Helping Seniors of Brevard County. We have television, we have radio, we have all kinds of magazines, all kinds of newspapers. We have an information specialist. We try to help people. We try to give you information so you can help yourself, help somebody else, and help yourself too. So there's a lot of helps going on there, folks, and it's all made possible by our sponsors. And our sponsors include some organizations such as Kindred at Home Hospital, the Eye Institute, Dr. Lee Sheldon, and Dr. Lee Sheldon is a periodontist, Bill Johnson, elder law attorney, this radio station, Wusthof Hospital System, Levin Home Care is on Beachside Assisted Living, Ebony News Today, Riverside Resort, Riverside Senior Resort, Organized Creative Solutions, Brevard Chiropractic and Injury Center, Cobblestone Real Estate, Market Street Memory Care, and notice those are just some of them. I'll mention some more later, but I got that litany. It was pretty long right there. But if you think back about what I just said, every one of those organizations is somehow involved with seniors. They recognize that seniors need information. Seniors themselves admit that they need information. We did a survey a couple of years ago, and we had two primary needs at 70% each. Out of the total survey came back 17% needed financial information and 17% just wanted plain old information. But it all boiled down to information and education. And once we know what to do, how to do it, where to go for help, how do we get connected to that help? And that's what Helping Seniors does. The phone number to reach Kay Kaiser, our information specialist, is 321-473-7770. And that's how I reach Kay. Call Kay, and you may hit her with one problem. She'll ask you a couple of questions. You might find out you got 3 or 4 problems. But that's good, because so many times what we think is our problem is not really the problem at all. The problem is something we don't think about. And that's why it's so important as we grow older and we think we have problems, we really have to get at the root cause of what the problem is. And sometimes we want to ignore that problem because of fear, because of the unknown, and fear of the unknown is a natural thing, folks. There's not a darn thing wrong with that. But what's wrong is if you have a fear and you try to do something about conquering that fear. So call Kay at 473-7770. Give her the problem. Let's see if you can help you. Today, our show is about chiropractic. I have Dr. Forrest Harvey from the Brevard Chiropractic and Injury Center is our panelist today. Kerry Fink, the Executive Director for Helping Seniors, new to his job, but he's been around the organization a long time. They're both in the panel in the studio with me, but Dr. Harvey is a chiropractor. And Dr. Harvey, how did you get started and even wanting to become a chiropractor? How did you determine that's what you wanted to do?
What helped me determine to become a chiropractor was I always knew I wanted to help people, and I wanted to help people in a natural way as far as their health. So I started looking into after undergrad, going to either MD school or pharmacist school, and I saw how many patients were on medications per se, or things that they didn't necessarily need to help their situation. They were more of a Band-Aid. So I picked chiropractic because it actually gets to the root of the cause, and I was able to actually help people by actually fixing them and helping by realigning their spine and helping influence their central nervous system and the body to heal itself.
You're kind of like Dr. Vashnov down at the Eye Institute. I had him on as a panelist on a television show, and Dr. Vashnov was talking about, he's an ophthalmologist and a retina specialist, and he got just like you. He began to think that, gee, we need to do more in prevention of disease and in treatment of disease early on, and see if we can't solve some of these problems before they magnify and become more of a problem. And so, in essence, that's what you're saying.
Yes, exactly. That's the exact same thing. I feel like a lot of prevention can be made by getting treatment before they actually get on these medications. I mean, there is a time that some patients do need medications, but I feel like a lot of these things can be treated by actually getting to the root cause biomechanically rather than fixing it with a medication from the doctor or something.
Well, I can relate to that because I'm 83 years old, and I've been through a lot of things. I've been through a dissecting and ascending aorta, and that's kind of a big part of the body. When that thing opens up in your top chest and goes all the way down into your belly, and you come through that thing, you got to feel that there's maybe a reason why you survived something like that. I went through a stroke. I've been through all kinds of operations. But I also know that I've had good doctors, good people helping me along the way understand some of the things that I had to go through with, and recovery from some of these things, it can be a traumatic thing in itself. The body responds in so many different ways, and one of the questions I always had is in regards to chiropractic. How do you know where to start? And we talk about chiropractic treatment. Perhaps you could just give our listeners a dissertation on what chiropractic is, how you diagnose somebody, and once you diagnose something, pick something, and give them sort of an explanation of how you treat it through chiropractic.
Okay. So typically, for instance, what chiropractic is we're a profession. We focus on disorders of the musculoskeletal system and the nervous system and how they affect a person's overall general health. Now, how we actually see what's going on with each patient's different. So when the patient comes in, we actually listen to what the patient's saying. We take a detailed history, write down everything that's going on with the patient as far as health concerns, what brought them to our office that day. We do an examination of that area. So say, for instance, low back pain. They come in with low back pain. We do an examination of the low back, see what's going on, if it's muscular, if it's nerve, if it's a combination of the two. It could be. So then after we do the exam, we always do some type of x-rays. The imaging helps us rule out any kind of congenital anomalies or any type of fractures, anything like that that could possibly be going on causing that pain. Once we get past the exam, then we do the x-rays. We have a really good picture of what's going on between the two. Then we treat the patient. If we don't get any good results within the first, 6 to 8 visits, then we may have to refer out to, a neurologist, the PCP, or we might have to get advanced imaging such as an MRI to detect like a herniation or something that we can't see on the x-ray, some type of soft tissue anomaly.
So you couldn't see a herniated disc on an x-ray then?
Correct. We cannot see a herniated disc on the x-ray because it's soft tissue. The x-ray actually penetrates through that soft tissue, so we wouldn't be able to see it on the x-ray.
See, of all radio shows and TV shows, I've never had anybody explain it that simple. It's amazing. It's just simply amazing. People listen to this radio show, and they'll say, gee, why didn't I think about that? Or why didn't that make sense? Making sense out of medicine is probably one of the most difficult things a person has to do throughout your whole life. And I think that more of us, Dr. Harvey, are becoming aware of the fact that we need to be more involved in our own diagnosis and our own care and treatment.
Exactly, yeah, and that's very true. I feel like it's definitely important when a patient starts feeling symptoms such as low back pain, or for the elderly population, when they start feeling things where they are feeling off balance, they're starting to lose their balance, they're not kind of with it like they used to be. That's when you really want to start getting on top of those symptoms to prevent it from becoming worse and you having more symptoms long term down the road.
I'm going through therapy now because of my back and my right knee problem, and I'm not sure if the knee problem was caused from nerves or caused from medicine I was taking, or if it was simply gout or what it was. All I know is it hurt me like crazy, and it affected my balance tremendously. So one of the things in therapy now is, and I really hate this, is because they put you in that piece of foam rubber, and they want you to stand on that piece of foam rubber. And so my therapist said, I want you to be able to do it for 30 seconds with your eyes open and then 30 seconds with your eyes closed. Well, I can actually do it for well over a minute. I just quit at a minute with my eyes open because that's how much I've improved in the last 3 or 4 weeks. But I can't even begin to do that with my eyes closed, because once you take away that reference plane, you're sort of operating in limbo there. You just don't know what you're doing. But I have found that if I can relax my body, I can maintain my balance easier. If I put stress on the nerve, the muscles, and I do this between a set of parallel bars and so I don't fall, and the low parallel bars. And I find that with my eyes closed, I have a tendency too quickly to want to grab and hold one of the bars if I start to lose my balance. But it seems to me that chiropractic can help with, well, how does chiropractic help with balance? So you answer the question.
Well, chiropractic can help with balance in numerous ways. The main way that we would do it is obviously realigning the spine. So getting the spine into its proper positioning, which allows the nerves that control the legs, control the feet to function at their optimum performance. Sometimes whenever you have misalignments in the back, it affects the nerves, and those areas that are controlled by those nerves, for instance, low back, the areas controlled by the low back nerves are the legs, the feet. They don't function like they should. As a result, a patient might have sensory loss, and then there you go. That equals your balance issues that the patient may be having. So we adjust the low back. We also can look into the feet. There's certain feet adjustments we can do, ankle adjustments, knees. I mean, you got to kind of look at it from the ground up. It's pretty much like a cinder block cinder block on top of cinder block as far as how the body's made. So the feet can affect the knee can affect the low back, and vice versa. So you got to kind of look at it as a whole picture to see how you can help the patient best.
I thought you were going to start singing the head bone connected to the thigh bone.
There you go.
Bone. I was waiting for you to start, but you didn't do it. Carrie, you're making me do all the talking. What do you have a question for Dr. Harvey?
Well, it's funny. We were talking about this before the show began, and I was asking him, I said, a little bit of your background, how did you come to decide that being a doctor in the chiropractic field would be the best thing? And he was explaining, and I thought it was fascinating, that his reasoning is, and I don't want to put words in your mouth, but I actually asked you to comment on it, was getting people out of pain, because you said you were actually looking at perhaps doing a pharmaceutical career where you would be looking at becoming a pharmacist, and you really said, I really want to see if I can get to the root of the problem. And I thought that was kind of fascinating. Could you maybe elaborate a little bit on that whole process?
Yeah, so as far as that, what I was saying was I wanted to get to the root of the problem, whereas sometimes a patient will go in and they'll say, hey, I have low back pain. The doctor will be like, okay, take this Flexeril, take this muscle relaxant, take this anti-inflammatory, this should help. Well, sometimes that is needed, other times it's not needed. So the patient might get a little relief, but it's not actually getting to the root cause of the problem, because most of the times the root cause of that issue is the patient's low back, the joints in that low back are either locked up, not moving well, things like that.
Let's say if a person does have low back pain, and it's caused by the sciatica nerve, or if you have spinal stenosis, and how does chiropractic help with that? And I have a reason for asking that question. What kind of a treatment would you recommend, Dr. Harvey, for a person that has spinal stenosis?
Spinal stenosis is a little bit trickier because what that is entailing is that the actual hole that the spinal cord runs through is becoming smaller. And usually that's due to arthritis building up in the spinal canal. So then you get there's not enough room for the spinal cord, and sometimes you get impingement and it's kind of pushing on the spinal cord. So there's different things we can do for that. Usually what most treatment we do for that is what's called flexion distraction table. You lay the patient on the table on their belly, and you literally flex the lower part of the table. What that does is it kind of opens up the back of that spinal canal, and it allows a little bit more room for those nerves to move, and kind of if there's any adhesions in there, it kind of breaks those up. So I actually have a patient now with that condition, so I'm implementing that as well as home exercise to stretch and loosen up those muscles in the lower back, because they get really tight as well, and he's actually getting good relief.
So you're talking about, like, if you see all these older people in the supermarket, Walmart, walking along, sort of bent over the shopping cart with your arms on the side of the shopping cart, what you're doing bent over like that is you're allowing the openings to the spine to open up a little bit and take pressure off the nerves.
Exactly. And that's why whenever in the grocery store, if they have back pain and it's relieved by pushing that shopping cart, what they're doing is they're flexing that low back slightly, and it's allowing the spinal cord more room to move. And as a result of that, they're getting less symptoms.
One of the exercises they had me do in therapy was to stand with my back against the bar and to thrust my back, arch my shoulders back by stretching against my back, and that sort of it was like a reverse stretch on the spinal stenosis. Does you follow what I'm talking about? Here, we're in the radio, so I'm a diet doctor. I already turned around, so I'm on a bar like this, and I'm pressing my back, arching myself back. How does that help my lower back?
So what they're trying to do with that is they're trying to get you have muscles that run along the lumbar spine on each side. They're called lumbar erector muscles. What they're trying to do when you do that is they're trying to get you to stretch those muscles and elongate them to help loosen up and allow the lumbar spine to move more freely. So you don't have as much muscle spasm in that area of the low back.
Okay, that makes sense. See, we can perform television over radio now. Actually, there is a lot that we can say over the radio that more people should be paying attention to regarding their own health, Dr. Harvey. There are people listening to this show right now that have back problems, have back pain. They don't know what's causing that back pain. And in many cases, they're afraid to find out what's causing a back pain, because we have, as we get older, we have a fear of all the things we've heard: osteoporosis, brittle bones, frail, collapsing the spine, narrowing of all the openings in the body. It's a frightening thing, because I mean, I know I can't. When I was in college and I wrestled, to do what we call a sit-out, I would kill myself now trying to do something like that. I wouldn't even try to get down on the, it'd be awful to get down on the floor, but much less to do a sit-out. And did you wrestle?
I did a little wrestling, a little baseball, a little basketball, did a little bit of everything.
So when I mentioned, that's why you smiled when I mentioned sit-out.
Mm-hmm.
What kind of pressure, okay, you wrestled. Now you're a chiropractor. Think about the stresses that you put on your body as a young boy and a young man, that many seniors that are listening to this show today did the same thing. And now as you get older, some of these things start to catch up with you. How does chiropractic treatment help people as you age? I'm thinking in terms of the importance of understanding the correct spinal alignment, doing what you can do within reason to keep your spine stable, how you can strengthen your body so that your spine does stay stable, because the spine is going to continue to go out if you don't do something. Well,
Correct, yes.
so what are some of the things that as we grow older, what are some of the things that we can do ourselves in order to help ourselves go older and not hurt ourselves as much as we can?
Well, the main thing is that I feel is to get the patient out of pain. Obviously, when you're in pain, you're not going to use that area as much as you would if you weren't in pain. So that's the main thing, is getting the patient out of pain. Once you get them out of pain, then you start implementing I always implement with my elderly patients some kind of at-home exercises, strengthening and stretching, because those are both very important to help the whatever area I'm treating become more flexible, help the patient, be able to move like they were able to in the past. At a better rate than what they currently are moving. So I always implement some type of at-home stretching and some type of exercises, and that's the most important thing for the patients to do at home and on their own. I always also try to get my patients to get into some type of aquatics exercise class or yoga class, because that's also really good with flexibility, and like they say, if you don't use it, you lose it, and that's very true with our bones and our muscle.
How do you, as a chiropractor, what kind of advice would you give seniors regarding a continuing of impact type exercises, such as, say, low weight barbells, dumbbells, doing things within reason to keep your muscle toned so that you can maintain as much strength as you possibly can, because once you start to lose the strength and muscle tone, you're starting to lose yourself, because if you have a problem, your arms and legs become so valuable.
Exactly, and that's the most important thing is getting patients to understand the importance of their muscles. It's very important that they continue within reason to strengthen the muscles, strengthen the legs. That way they prevent any kind, that prevent muscle wasting, and in preventing muscle wasting, you're going to prevent the chances of falling and being in the hospital for long procedures such as things like that. So I always try to implement that as much as you possibly can.
Do you believe that the type of treatments that you recommend you help people maintain their balance and prevent falls?
Yes, because in addition to the chiropractic care, I also give them supplements for at home, and the main thing is giving them exercises and things to do at home that helps with their balance and their coordination issues.
I think a lot of people don't realize that, and when we come back on the second part of the show, I'd like to start off with you talking to the audience, our listening audience today, about the importance of maintaining your strength elements so that you can maintain a sense of balance and prevent falls. So with that, we're going to take our mid-show break, folks, and we'll be back on the other side in about 3 minutes. Do stay with us, because Dr. Ari, we haven't even touched what we're going to talk about, so stay with us.
Ed Dean, weekdays 5 to 7 p.m. on FM 99.9, 94.7, and 100.7.
We're back live with the second part of the show, folks. Remind everybody that we're live in the station here at WMEL today. My panelist is Dr. Harvey from the Brevard Chiropractic and Injury Center. I get that right. But we have a bunch of sponsors that help make this all possible, and I'll read some of them. Senior Scene Magazine. For those of you who don't know about Senior Scene Magazine, it reaches about 40,000 people on the Space Coast, and they publish our 8-page newsletter in there. It's just a fantastic magazine. You can get it all over the county. If you haven't seen one, you can go online and read it online. You can go to our website, helpingseniors.brevard.org. You can look at all the radio shows, the TV shows, all our articles in Hometown News, Senior Scene Magazine. The purpose is to make information available so that you can educate yourself about the resources you need and how you can connect with those resources. And that's why you need to call Kay Kaiser at 321-473-7770, because she can help you. Kay Kaiser. These sponsors include Hometown News, Spotlight Magazine, Seniors Helping Seniors, Courtney and Braswell Financial Advisor, Barbara McIntyre, Home Equity Specialist, Joe Pons from Canadian Meds of Melbourne, Vitas Hospice, Ear Care, Aldea Today, In-Home Personal Care Services, Veterans Realty, just a whole bunch of people, folks. And if you need help, if you just don't know what you need, call Kay at 473-47770 and ask her. For instance, those of you that are unremarried widows of World War II, Korean, and Vietnam veterans, if you qualify for financial assistance, and you'd be surprised, most of you do, it could mean an additional $1,200 to $1,400 a month, and you'd be surprised how many people don't even know about this. So Call Kay. She's a lot she can tell you. Carrie, I'm going to turn over to Carrie. Carrie's got a couple of questions for Dr. Harvey.
Yeah, we were talking before the show, and I thought it was fascinating because a lot of people have experience with chiropractors. But let's say somebody is sitting at home and they're listening to the radio show, and all they know is that they've got some pains and that they've probably been to their primary care doctor, and the answer is typically another prescription from the prescription pad. But even that may not necessarily be giving them the relief that they're looking for, and that's why I wanted to ask Dr. Harvey: what do you see from patients who come in? What might they expect on that first visit, and how are the things that you do helpful for them?
Well, the main way for them to even determine if they needed care it's very simple. Just call us and schedule an appointment. We do free consultations of no charge. So literally, I would be able to go in the room, listen to them, take their history, hear what's going on. That part of it's free. So there's really no need for them to ever have to stress about if they feel that they need care or not. Now, typically what we do on that first visit is we do an examination of the area. I take a detailed history first, then we do an examination, and then we do some type of imaging. So if they have recent imaging, we can get it requested from wherever they got it from. That way they don't have to pay for it again. Or we have x-rays on site. We'll take x-rays right there. And then that's the first visit. They get some type of therapy done on the neck, so ultrasound, electrical stim or heat, something like that. And then the next visit they come in and we do a report of findings. So I show them everything that's going on their x-ray, and then I give them their treatment plan, what I feel they need, how often they need to come in, things like that.
And do you have what's the level of success ratio that you see? Somebody says, well, I'm coming in, my back is hurting, I'm having trouble bending over, or something like that. Is there an expectation that people come in and say, well, with this program, is this going to make an impact on my life?
Well, that mostly depends on if they have pre-existing conditions. So, for instance, if they have some type of cervical or lumbar fusion, so some type of spinal fusion where the bones are fused together, the prognosis is a little bit less because obviously they have some pre-existing condition. They're going to have a lot more arthritis built up. So it kind of depends on patient to patient. But if a patient usually if they just have a little bit of arthritis in there, I mean, the success rate is really high. I would say probably 90% of my patients I'm able to help.
And so because it really is sort of you have nothing to lose by making a call and at least availing yourself to get an understanding of it would seem like a prudent step in the right direction.
Exactly. There's nothing to lose. It's relatively cheap compared to other routes of medicine that you can go. So, I mean, at the most, you come in for your treatment plan. You do your whole treatment plan. If it doesn't work, then we usually refer out. But like I said, that very rarely occurs.
So it really does make a difference for people.
Oh yeah, definitely.
I want to go pick up on something. Let's go back, Carrie and Dr. Harvey. Let's think about the name of your business, Brevard Chiropractic and Injury Center. And I want to approach it from the standpoint of, you see so many car accidents, or you see, let's stick with car accidents for a minute. Rear enders, whiplash, neck pain, spinal injuries. Many of these things, treatment is covered under the insurance policy if you understand the fine print of the insurance policy. But what people don't realize is that they've got to make this injury known. And there's something called the 14-day rule. And if you are involved in a car accident, now this is the way I interpret it. If I'm involved in a car accident and I have neck whiplash or back whiplash, and if I don't make that known to my doctor or get it documented officially within 14 days of the accident occurring, and say something springs up 6 months later, I might not be able to claim it.
Yes, and you're exactly right. So with the 14-day rule, what that entails is if you don't go and, like you said, make it noted that you have those injuries from that car accident, you lose your PIP coverage. So PIP coverage is personal injury protection. So anytime you're in a car accident, you get $10,000 for PIP coverage. I'm pretty sure that's the limit. And then if you don't get a examination or let someone known of those symptoms within 14 days, you lose that whole $10,000, and you have to pretty much pay out of pocket or go through your insurance at that point. So at the worst, I would say if you're ever in an accident, just go in and get it checked out at the very least.
That's what I wanted you to say. I hoped
Yeah.
you would say that. You know, this is not. We're not trying to talk about the average citizen becoming an ambulance chaser, like you see on some of these television shows. Kind of got these shifty, beady-eyed characters trying to see how much they can recover from somebody that's been in a serious accident. But I think knowledge of what you are entitled to in the events you are subjected to undue injury or something. If you, let's say, if you fall someplace, and if you, you know, you may be fined for a week or two, and then you later on that's when a lot of these injuries resulting from falls don't manifest themselves right away. Talk about that for a minute, so.
Yeah, exactly. A lot of slip and falls. I have a lot of patients that actually are slip and falls in stores, and like you said, a lot of the symptoms don't manifest right away. It takes sometimes anywhere from 2 to 3 weeks before patients start getting symptoms. From those accidents, a lot of soreness, a lot of inflammation. Once that sets in, then the pain comes. So sometimes it takes 2 weeks, 3 weeks for that to set in. Well, if you didn't go to get it checked out in that first 14 days, then it's kind of hard to get coverage based off of that slip and fall. So that's another thing. Just go in, get checked, describe the injury to the doctor that you're going to, tell them everything that happened, get it documented. That way, if you do have anything down the road, you already have it documented, you're good to go.
I would venture to make a statement like this, Dr. Arvin. You comment on it. Let's say, is it common or uncommon for people to have a problem and discuss it with their primary care doctor? And would a primary care doctor be reticent or open-minded to the use of chiropractic treatment along with their treatment?
That's a good question. That's a good question, and it's kind of it's tough to answer because you have some docs that are very pro chiropractic, and you have some that are against it a little bit. So it kind of depends on, case by case scenario, who the doc is and what their experience is with chiropractic. Sometimes, just like patients, they might not understand what we do. And that's the main thing, is just educating them as well as the patient that we're treating. Hey, so-and-so, Mrs. Jones is in our office today. We're treating her for XYZ. We understand she gets care in your office. This is what we're doing. Hopefully we can co-manage this patient together to better help her with her health care or health in general. So that's the main thing, is we just, as professionals, we also have to communicate better to better understand each other. And that's what we're trying to do more of now.
And the other question area that I would say, Kerry, he might think of something because I'm going to get you to talk to him in a minute. But I'm thinking in terms of people 75 and older. And as we do encounter things such as osteoporosis, a softening of the bones, becoming other diseases affecting us as we're older, how important does the use of a chiropractor become in terms of maintaining our range of motion, our ability to walk, and do so with a fluid motion? How can a chiropractor help us do that?
Chiropractor can help you do that by keeping those joints moving. Once those joints get locked up, low back, knee, ankle, once they get locked up, it becomes, obviously you lose range of motion, it becomes harder to move. So the main thing that the chiropractor focuses on is getting those joints moving, getting the areas moving the way they properly should, aligning them again. And by doing that, you help decrease any inflammation, swelling in the area. You help decrease nerve interference. So as a result, the muscles around that area also work better. And as a result, the patient has better outcomes.
Would it be unreasonable for a person as they got older to subject themselves to a chiropractic, I would call it maintenance treatment on a weekly basis? Would that be something that would be too often, or is that often enough?
Well, it would depend. I mean, it depends because anything can affect the amount of healing time, such as if a patient has pre-existing conditions, such as diabetes, if a patient has gout, hypertension. Those things all kind of slow down the healing process. So it takes longer for those type of patients to heal. Their maintenance plan might be, like you said, once a week, whereas someone who's 75. Same age, they might not have all those symptoms, so they might have just a little bit of osteoarthritis, whereas their treatment plan would be, once a month per se. So it kind of depends patient to patient.
So it would be it would be beneficial for older people to at least get an examination by a chiropractor so they can see. A chiropractor could recommend chiropractic treatment. A chiropractor, if he or she really wants to help the patient, they could recommend chiropractic treatment. They might recommend physical therapy, and they might recommend just a good walking program.
Exactly, and those are all important things, and that's the main thing is that it's not just chiropractic that you're getting the knowledge of what's going on with your body, how to fix that at home, such as stretching exercises, supplementation, so things where a patient might have, for say, osteoporosis. You might put that patient on some vitamin D supplements, some calcium supplements, things like that to help strengthen those bones and help that patient live a better overall life.
Should these be the same type of thing a primary care doctor should be thinking about?
Yeah, I very well feel. I feel like anytime a patient comes into you and they want help, I feel like that's what they should be getting. They should be getting they should get whatever is available to them. You should always let them know everything that's available to them, and that's what I try to do. If I try to always educate the patient up front, what we can do for them, and other routes of care that they could take.
I'm not trying to start a war of the world between doctors now or different doctor specialties, but folks, let's just be thoughtful for a minute. Think about your primary care doctor, your dentist, if you had a chiropractor, maybe another type of medical, a neurologist. Maybe if you knew that these people were talking to each other, and I'm very fortunate because I happen to have a cardiologist, a primary care doctor. I go to a couple of people for therapy, and they all talk to each other. They all send what doctor they send to the other doctor, and I feel like but I think there's more of a tendency in medicine today to do that, isn't it, Dr. Harvey?
Yes, it is. It is. It used to be, like you said, it used to be a war between different professions, kind of more back in the day, but today it's starting to become more accepted. Everyone's starting to communicate better because we're starting to realize that that's the best way to truly help that patient is by communicating our care. That way we're not doing something that coincides or makes what another doctor's doing worse. So we try to all kind of game plan together, and that gives the patient the best results.
Which brings us to the fact that if you are going to any type of a doctor, folks, you should be willing to make your other treatment areas knowledgeable about all that you're participating in, so they get a better idea. Because there could something a chiropractor may do something that would cause something to happen. I'm not imagining what it is, but if the primary care doctor didn't know why that happened, it could probably put him as a loss as for making a diagnosis, and he could come up with an incorrect diagnosis.
Correct.
Okay, Gary?
Well, that was one of the questions I was going to say. Again, for somebody sitting at home may not be really familiar with the benefits of what they might gain through chiropractic. And I thought it was fascinating, Dr. Harvey, when you were talking about the basic definition of what you do as a chiropractor, that you're actually helping the body work within the way it was designed. And I just wanted to get you to comment that for a person that's kind of a beginner or a novice with it, what the actual approach is and why it's beneficial.
So the actual approach is to actually get the body to be in its normal positioning, those joints of the spinal column, any joint. The joint of the spinal column is the most important because the spinal cord is right there. And as we know, the spinal cord goes to the brain controls the whole body. Spinal cord, the nerves come out of the spinal cord, that controls the whole body. So it's just such a powerful structure in our body that when those joints are misaligned in the spinal column, it causes interference to either the cord or the nerves that come out of the cord. As a result, you get deficiency. So you can have decreased sensation, you can have decreased muscle tone, there's a bunch of things. You can get GERD, you can get We help with asthma. We help with any type of GI distress. We've been known to help with patients that are bedwetting as children. So there's a ton of things that we help with just by realigning those bones to the proper positioning and allowing the nerves and the body to work at their optimum level and heal itself.
This is what Joe was talking about, alluding a little bit earlier. We had just done some television program with Dr. Vaishnav from the Eye Institute, and he was talking about how important each of these specialties can be at helping somebody understand. He gave the example of a person that through an eye exam, he was able to prevent a stroke because he saw something happening on a particular scale that he was able to alert the primary care physician that this was going to be a problem if it wasn't addressed. I'm sure that as you examine a patient and work through that, there's probably times that you've been able to create something or see something that would be of great benefit to a person's primary care physician. Say, this is how these two things work together, and this might be something you look at. And conversely, a lot of times you're able to help somebody just because you're getting the body to work with itself.
Exactly, and that's very true. There's things such as a couple things I can think of off the top of my head. Looking at a lumbar X-ray, and you see the patient's abdominal aorta might be bulging. That's immediate cause. Sometimes you need immediate surgery. You got to go right under the knife to get that fixed. So literally, that's one of those times where you would refer to their PCP, get their PCP on it. That way, they understand what's going on. Another one that commonly comes in is hypertension. Patients have high blood pressure. They don't know it. They don't really keep an eye on it. Well, every time we do an exam, we do vitals, so we take the blood pressure and we can kind of see and track it. And if they continue to have high blood pressure, refer to the PCP, get them on the medication they need.
One thing we haven't talked about, and I do want you to talk about this because this is something a lot of seniors don't know about. And we're talking about, as we go older, a lot of our injuries in the back are caused by compression. The spine gets compressed. You have a machine there that does decompression. And I think it can just tell our listeners how you all work to decompress the spine by elongating the spinal openings through your machine that you have.
Yeah. We have a non-surgical spinal decompression machine. So what that does is the patient literally lays down on their back and it forms a axial traction. So it literally pulls the lower half and the upper half, kind of separates the two very gradually, very slowly. We put you on a treatment plan to where we work the patient up to the maximum pull is 50% of their body weight. So we slowly do that in increments depending on how the patient presents and how they feel each visit. And what that does is it helps decompress the spine, and it allows the if they have a herniated nucleus pulposus or a herniated disc in that low back, it allows the area to kind of decompress and the nerve to become less inflamed from getting irritated by that herniated disc, and as a result, it helps relieve symptoms from that.
I think that's important for people to understand because when generally people will think about the inversion table when you're going to put somebody, hook them up with your fields and turn you upside down.
Yes,
and you're hanging well, I couldn't do that because I'd have this aorta problem, and I would have probably killed myself if I'd upended myself on that thing. But you can by going to somebody, Dr. Harvey, that understands what is happening inside the body, especially with the spine, there's a lot of things that you can do to help yourself. An inversion table can be used by many people, but you may not use the 90-degree treatment method. You might do something on a 30-degree or 40-degree and would accomplish the same thing. But the decompression machine, as I remember the one I saw used by a person, was when you sit up, it starts or laying down, like you say, over a period of time. And this is not something that happens over a couple of weeks.
No, not at all. It takes time, and we can use it for the low back herniations as well as the cervical spine. And many times I've already treated patients that had these conditions and saved them from going and getting surgery. So it's very effective treatment, and a lot of patients are really grateful that we have it at our office.
Gary?
Well, it's the same question. Is what you're able to do is actually, I was telling Joe that the TV programs that we have archived on the Helping Seniors website, some of the most popular ones have to do with pain reduction and how to manage pain. And really what you're offering, when you think about it, is a kind of a holistic approach that's getting the body to work within the way it was designed and created so that people can get relief without necessarily getting another prescription or something like that. And I wanted you to again kind of like focus in, like, who's the person that should call the office and say, these are the kind of symptoms I'm having. Is would this make me a good candidate to come in?
Anyone that has pain, literally anyone that has pain. If you have pain, give us a call. Like I said, consultations are
What's
free.
that phone number, Dr. Harvey?
The phone number is 321-631-1100. Brevard Chiropractic and Injury Center is the name of the place. And yeah, anytime they have pain, just call. Consultations are free, so we can always sit down, talk about it, and see what's going on and see if you're a good candidate.
He needs to talk about his own business more, folks. I asked him that question. I caught him looking at a pamphlet to see what the phone number was, but he knew what the name of his business was. He didn't doubt that there. I've enjoyed, Dr. Harvey, having you on the show today. I think it's always helpful if our listeners can see something that's been around a long time expressed in a language that they can understand. And you have certainly done that today. And we'll have you back again, and we're doing the same thing on the TV segment, because the more we can talk about chiropractic, I think the better off everybody will be. But thank you for being with us today, and thank you, Carrie, for being here with us in the studio, and thank all of you for listening, and stay with us. We'll be back next week. Have a great weekend. Bye-bye.